Hello. In this video I would like to explain to you about the uses and development of the drug spironolactone. Spironolactone is a potassium-sparing diuretic used to treat patients with hypertension, edema and ascites from liver cirrhosis. The drug's target is the mineralocorticoid receptors and acts as a competitive antagonist preventing the binding of aldosterone. Discovery. Aldosterone is a hormone secreted by the adrenal cortex and regulates electrolytes and water by increasing or decreasing the renal reabsorption of sodium and potassium. Edema is a disease where an excess volume of fluid accumulates in the tissues. This occurs due to the actions of aldosterone at the mineralocorticoid receptors at the tubules of the kidney. Binding of aldosterone at these receptors results in an increase in apical epithelial sodium channels, intracellular sodium and potassium ATPase, and apical ROMK, renal outer medullary potassium channels. This allows for the increased reabsorption of sodium and potassium into the blood from the filtrate. This discovery meant that scientists realized aldosterone was responsible for many diseases caused by edema and hypertension, such as progressive renal disease, vascular injury, vascular fibrosis, cardiac excitation, thrombogenesis, cardiac fibrosis, and cardiac remodeling. The next step was to find an antagonist of the mineralocorticoid receptor, and this led to the discovery of spironolactone. Early experiments involved producing molecules with both progesterone and digitoxin moieties, as earlier research showed these as natriuretics in dogs. This is how the molecule SC5233 was produced. Following on from this, assays of mineralocorticoid-dependent sodium retention in rats were carried out. SC5233 was tested on a hypertensive animal model and found to have antagonistic properties. Further development involved replacing a methyl group for a hydrogen, which produced the molecule SC8019, and subsequently adding a thioacetyl group led to the discovery of spironolactone. These changes maximized the oral bioavailability and pharmacokinetic profile of the drug, as the earlier drugs were only able to be administered parenterally. The original synthesis of spironolactone involved 6 steps. In step 1, 17-alpha ethinyl 5-androsten 3-beta-17-beta diol was treated with a Grignard reagent and carbon dioxide to carbonate the molecule. This gave an acetylenic acid with a carboxylic acid group at the alkyne bond. In step 2, hydrogenation of the acetylenic acid was completed using hydrogen and a palladium calcium carbonate catalyst, which causes the carboxylic acid and alcohol to form a cyclic ester, which is also called a lactone. This is now an unsaturated lactone. In step 3, the unsaturated lactone is saturated by reduction using hydrogen and a palladium carbon catalyst. This now gives a saturated lactone. In step 4, the saturated lactone is treated with an oxidizing agent to oxidize the alcohol group to a ketone. In step 5, oxidation using chloranil introduces a double bond into the second ring of the structure. Finally, in step 6, another oxidizing agent is used, this time selenious acid. This introduces the thioester group, giving spironolactone. Mechanism of action. The main form of secondary hypertension is primary aldosteronism, and this is present in 5 to 15% of all cases of hypertension. As such, treating the aldosteronism will have an effect on blood pressure as a result of the renin-angiotensin-aldosterone system. Aldosterone is a steroid hormone that acts as a hypertensive molecule by altering the permeability of the distal tubule to sodium. It binds to mineralocorticoid receptors and mediates upregulation of ENaC, epithelial sodium channels, causing more sodium to be reabsorbed into the blood. This results in more water being reabsorbed and then a higher blood volume, leading to hypertension in primary aldosteronism. The mineralocorticoid receptors mediate this mechanism through activation of SGK1 and subsequent phosphorylation and inactivation of NED24. NED24 is a ubiquitin ligase that controls the ENaC expression by tagging them for ubiquitination and destruction by a proteasome. As such, inactivating NED24 will increase ENaC concentration. Spironolactone acts by antagonizing the mineralocorticoid receptor and as such preventing the binding of aldosterone. This will prevent the inactivation of NED24 and cause downregulation of ENaC on the distal tubule of the nephron by ubiquitination. This reduces the amount of sodium that is reabsorbed into the blood and as such reduces the blood pressure. Structure. With regards to structure, spironolactone is a cyclic ester, known as a lactone, with a substituted thioacetyl group at C7 and the gamma-lactone moiety at C17. It also has a cyclic ketone. Spironolactone is a pharmacologically active prodrug, with its active metabolites being canrenone and canrenoate. These are produced from first-pass liver metabolism by a cytochrome P450 enzyme, which removes the thioester to produce canrenone, and the lactone cyclic ester is split open and ionized to produce canrenoate, which is still biologically active. Both have a half-life of 17 to 22 hours. The structure-activity relationship. Crystallization studies have shown that the cyclic ketone on both aldosterone and spironolactone forms hydrogen bonds with glutamine 776 and arginine 817. The ketone of the lactone group has a very close contact of around 0.6 angstroms with the side chain of phenylalanine 956, which may be the source of its antagonistic effects. Spironolactone prevents the receptor from adopting its bound conformation by failing to mediate hydrogen bonding to astatine 770 and threonine 945, whereas aldosterone does. This is due to the proximity of the lactone ketone to astatine 770, which is further than that of the ketone in aldosterone, so produces weaker hydrogen bonds. This leads to helix alpha and AF2 activation function 2 helix not being arranged in the correct position for activation. Electronic topological methods were used in another study to identify the pharmacophore and the optimal distance between the two oxygens in order to have the closest hydrogen bonding interactions. They found that the 5 cyclic rings between them produced an optimal distance of 13.2 angstroms for mineralocorticoid antagonist activity. The pharmacophore identified was C2, C6, C12, C26, as well as oxygen 1 and 3. Side effects of spironolactone are caused by its relative unspecificity to the androgen and progesterone receptors. The side effects include male breast pain and enlargement, called gynecomastia, which could be caused by the drug's ability to slow down the production of androgens and increase the metabolic clearance of testosterone. This can also cause alopecia. There have been some studies to suggest that the drug is linked to the development of breast cancer. Additionally, spironolactone increases the potassium levels in the blood, and so there is a risk of these levels becoming too high, a condition called hyperkalemia. Symptoms of this are tiredness, nausea, numbness, and chest pain. Hyperkalemia is also a contraindication, so if a patient already suffers from this condition, they should not take spironolactone. Other contraindications include Addison's disease and anuria. Spironolactone can also cause metabolic acidosis, acute kidney injury, agranulocytosis, and gastrointestinal disorders. To summarize, spironolactone is a drug that stops the actions of aldosterone by acting as a competitive antagonist at the mineralocorticoid receptors. This is an important treatment as the activity of aldosterone can cause many diseases such as edema and hypertension, which, if left untreated, can lead to further complications. I hope you enjoyed this video. Thank you.